Good afternoon, everyone. And it is with great pleasure that I invite you to the first session of the Academic Hour 2026. So after a long hiatus, we are pleased to announce the return of our prestigious series of lectures of the Academic Hour, continuing professional development lecture series organized by the Mahiyanganaya Clinical Society in collaboration with the branch union of the Government Medical Officers Association. So today we'll be basing our talk on the medico-legal issues related to medical officers. This session focuses on safeguarding our professional career through greater legal awareness. So to guide us through, we've invited Dr. Dinesh Peries, Acting Consultant GMO at Base Hospital, Mahiyanganaya. So now I would like to invite Dr. Prabhash Hatharusingha, President of the Clinical Society of Base Hospital, Mahiyanganaya, to introduce today's speaker. Over to you, sir.
Right, thank you and welcome you all for the first academic hour program. So after a little bit of delayed starting, we plan to continue this session for this year. Clear-cut, exact plan like we did. Actually, we saw that slideshow and it shows really a very good past sessions in Clinical Society, Base Hospital Mahiyanganaya. So this year I will give a brief introduction. So we try to have at least 2 lecture series per month with some 3 outdoor functions with a dinner and music and a lecture. So that's a brief introduction. So we try our best to adhere to that plan. So today's lecture, today's speaker, Dr. Dinesh Peries, Consultant GMO Base Hospital Mahiyanganaya. Dr. Dinesh graduated from University of Colombo, MBBS, University of Colombo in 2014 and obtained MD Forensic Medicine, University of Colombo. He worked as a undergraduate trainee in Teaching Hospital Galle, Teaching Hospital Kalubowila and Teaching Hospital National Hospital Colombo. So he had his foreign training fellowship in Malaysia. So after foreign training, he worked as a consultant GMO in Base Hospital Mahiyanganaya. And actually, I would like to thank him to because he's the one who initiated and he encouraged me to start this session because this topic is very much relevant to all the medical officers, the medical legal issues related to medical officers. So day-to-day practice, we had so many encounters as a junior doctors, even as a consultant. So I think this is a very good topic. And I again thank you very much, Dr. Dinesh, to choosing this topic and starting this lecture series with you. So I would like to invite Dr. Dinesh to start the proceedings. Thank you.
Thank you, Dr. Prabhash. So good afternoon to all the consultants and all the medical officers and everybody. Right. So it's a very important topic. So medico-legal issues related to medical officers. So I'll be covering a lot of variety of aspects. Yeah. Right. So what is this cause of death, mechanism of death, manner of death? So we know the manner of death, no? So you have natural manner of death, you have suicide, accident, homicide. And what is the discrepancy between the cause of death and the mechanism of death? So some people get this shuffled together. So cause of death is the injury or disease that leads to physiological termination of that individual. So that mechanism of death is the physiological process. So now you don't write heart failure and those things for the cause of death. So those are the mechanisms. So you have to differentiate this cause of death and the mechanism of death. Okay, so there are references. So this cause of death, there are references in the forensic medicine textbooks. Right. So this natural manner of death. So who can give this cause of death? So actually, now it's a natural death. If the attending the general practitioner can give the cause of death in a natural death normally. Person dies at home, okay. So Grama Niladhari can give the cause of death. state superintendent can also give the cause of death. So some people don't know these things. So there are separate forms for these things. And the inquiry into sudden death or the coroner, he can also give the cause of death. So a lot of people there are to give the cause of death, but there are certain instances they cannot give the cause of death. So what are those instances? Right. So and all inquests don't go for the post-mortem. So where can we read this? Where is this? All these procedures. So there is this Code of Criminal Procedure Act, number 15 of 1979. So it's like a book. You can read it. You can Google it, and you can read. So in these sections 369 to 373, there it is described who is a coroner, who can conduct a post-mortem, what will go for the inquest. Everything is there. So you can anytime you can Google it and you can read it. So welcome director also. And you will see what should go for the inquest, and the inquiry will decide if it's falling into those lists. He will order the post-mortem. Otherwise he can give the cause of death also. He will check the medical reports and past medical history, and he can give the cause of death. So some people think now it has gone for inquest. So some people contact me, can you do the post-mortem quickly? So actually that coroner has given and they have gone home also. Sometimes it doesn't go for the post-mortem. So all inquests don't go for the post-mortem, only some, and we'll see what are these things that will go for the post-mortem. So that is there in the Code of Criminal Procedure Act. Right. So sudden or unexpected death, death occurring suddenly, and cause of death unknown or doubtful. So those instances the coroner will put it into the post-mortem. Then accidental or unnatural death. So death due to accident, animal attack, animal bite, machinery injury, poisoning, violence. So they will be referred for the post-mortem. So suspected suicide. So where there is information that the deceased has committed suicide, or suspicion of an offense, where there is reasonable suspicion of homicide or other criminal act, or death in custody. So death in police custody, prison, mental hospital, state detention. So all these things will be referred for the post-mortem. So apart from this coroner, the inquiry into sudden deaths, so these homicidal cases, deaths in the mental hospital, that magistrate order will come for the post-mortem. Right. So ultimately who will give this death certificate? So people think we are giving the death certificate, we are giving the cause of death. So ultimately in the hospital or in the region we have the birth and death registrar. Okay, so that's the person who will give the death certificate. Okay, so I have a small video, we'll show it later. Okay. Right. So what is this cause of death? How to write this? So it's there in the WHO. So WHO format, the cause of death, 1A is the immediate cause of death, 1B is the antecedent cause of death, and it can go on and on, 1A, 1B, 1C, 1D, 1E, you can write what is it due to. So immediate cause of death and antecedent cause of death, what is it due to? Ischemic heart disease, 1A, due to 1B, coronary artery atherosclerosis. So contributory causes, you can put the chronic hypertension, diabetes, mellitus, those things that are contributing into the 2 contributory causes. So these natural causes of death, how to know what to write? So it's there in the International Classification of Diseases. The latest one is 11. That's the latest one. So published by the WHO in 2022. So you can just Google it up. You can read these things. Okay? Latest global system. Right. So you can see about the numbers also. They have specific numbers. So acute myocardial infarction is BA41, and type 2 diabetes mellitus 5A11. So there are different numbers. So you can write those numbers also as well for statistical purposes. Quickly, then you can analyze. Okay. So all this you can Google it up and you can see. Right. So other medical legal issues in examination. So some people don't know these things. So consent. Okay. What is the age? You can give the consent. It is 18 years. So if it is less than 18 years, definitely that parent or the guardian should be there. And this is not relevant in the life-saving and for the best interest of the patient, you can do that. Other instances, for examination purposes, if it's not more than 18 years, definitely parent or guardian should be there, otherwise it is not valid. So medically, what we do is, if the parent or guardian is not there, we go for the court order, and they come with the court order. And sometimes sexual abuse cases, sometimes even with the court order, they refuse examination, so we can't like force and do the examination. If they refuse, we have to write it in writing, I'm refusing the examination, and they will sign it. Okay, don't do anything by force. And this informed written consent, so you must explain any material risks of treatment and alternatives, because UK there have been some trouble without explaining these things. There have been court cases, and they are now telling to explain all these things. Okay, any material risks of treatment and any alternatives. And chaperone. Okay, so they advise to have a chaperone of the same sex, male, not male. So then if you're female, a female. So I had an experience in Gaul. Okay, so there was a female in appearance, sexual abuse. Okay, and when we went to examine, there were scars in the groin. So we asked, what is this? So he told that he has gone to Thailand and he has got a surgery done, and previously he was a male, and now he's now become a female. A big issue, no? So now you have to see the external appearance, transgender. Externally looks like a female, so we have to have a female chaperone, even though he has had surgery and he's a genetically XY. External appearance is female, so we have to go with that. So those type of people are also there in the community, transgender people. So according to the external appearance, have a chaperone of the same sex. Okay? So people have got into trouble with these consent issues and chaperone issues. And don't do anything by force. Okay? Always safeguard yourself. Right. And some more, in clinical cases, always mention the date and type and your name. Okay? And document injuries with diagrams if possible. So definitely burns, you mark the diagram. Okay, rule of nines. And other instances also try to mark with a diagram, so better to understand. And get the injury side also correct with the documentation. Sometimes I've encountered pediatricians where they have got the injury side wrong. So why is this? Because this can be obtained by the courts, and they will check the BHT and they will say why this left right side injured, marked left side. Then you will be called to the courts to explain. Okay, so get the injury sides correct. Okay, document injuries with diagrams if possible, date and time, and your name. Okay, and sometimes see the initials only, we don't know who has seen. Okay, try to write your full name if possible. Right. So some more. So what is this statutory rape? So in the law, in the penal code, it is explained that for sexual intercourse, that consent can be given more than 16 years. If it's less than 16 years, even if consented, it is taken as statutory rape. So if you encounter a person less than 16 years and pregnant, so it will go into the statutory rape. So definitely inform the police, and they will insert the MLA form, and we will see the patient. And sometimes these cases also you will get that parent or guardian not there, and you have to go for a court order for examination purposes. And sexual abuse cases, you know, the referrals apart from the medico-legal, psychiatrists and venereology referrals will be done. And this new thing, this gender-based violence, okay, wife battering, or they are not married but some affair is there and there's gender-based violence. So again, refer to the forensic department and the psychiatrist. And in the provincial secretariat or this AG office, we have this women's development officer, so we can have some small case conferences, and we can arrange some things for these women. Yeah? Right. So another aspect here, the child abuse cases. So admitted at the pediatric department. So there are different aspects of child abuse, not just the physical. So it can be sexual, could be emotional, could be neglect, or it could be exploitation. So employment below 14 years, the new age is 14. Okay. So if it's there, report to us. So apart from the pediatrician, so it can be referred to the VOG, STD, psychiatrist, all these various aspects are there. Okay. Child abuse. So another thing, torture cases. So torture cases, apart from the medico-legal, sometimes we may need to refer to the VP or the surgeon, and definitely psychiatry as well. And drug addicts. So we have the multi-drug urine test kit, so you can refer to us. You can check the urine for drugs, okay? And the best person to assess for rehabilitation is a psychiatrist. So through us, we can refer to the psychiatrist, or you can refer to psychiatrist as well. Different aspects. So the other thing is this examination for under influence of liquor. So after 4 p.m. the OPD doctors see for under influence of liquor. So how to assess this under influence of liquors? So the College of Forensic Pathologists has developed a score. Okay, they say now just breath smelling part, don't take it as for under influence of alcohol. So they have in the MLE form this there is a box for breath smelling and there is a box for under influence of liquor. So now they are saying that this smell of liquor can be due to if you person consumes a toffee or any food with that same smell, that person can now also have that smell, or sometimes has some gut bacteria that will develop that smell. So that smell is not a very reliable factor, because anyway liquor is a odorless, colorless compound. So that is not a good factor to assess for under influence of liquor, this smell. But what we do here is we give a score. Sometimes there is this odor. So 1 mark is given for breath smelling. And we, in the worldwide, they have developed this field sobriety test. These 3 main tests, which is given 2 marks each. So lateral nystagmus in the eye is given 2 marks. So 1 leg stand test is given 2 marks, and walk on a straight line test is given 2 marks when you examine. So if you add these things up together, so 6 marks here, and the breath smelling has 1 mark, so altogether 7 marks. So out of those 7 marks, if you get 4 or more, you can take as under influence of liquor. So sometimes there is some problem and he can't stand on 1 leg or something. You can't do that test. Then you can do the other cerebellar tests. Okay, heel chin test, dysdiadochokinesia, finger nose test, those tests, and that will be given 1 mark each. And again you can give out of 7, or you can increase up to 9, and out of 9, if it's more than 5 or more, you can take as under influence of liquor. So now it is easy, no? Otherwise we don't know how to say if it's under influence of liquor. You are just getting a smell and you don't know what to do. And so now you know that there is a score, and now you can do these tests and you can assess for under influence of liquor. 4 out of 7 or more, or 5 out of 9 or more. And the other thing is now this drunk driving related offences. So it is not just liquor. Now cocaine, amphetamines, marijuana, and these bus drivers, they eat this thing called MAVA. So that with MAVA they have this marijuana also included. So these drugs are also consumed by the drivers. So not just alcohol. So you can check the pulse rate and blood pressure, those things. So these amphetamines, cocaine, and those things will be very sympathetic system will be activated. And heroin is not usually consumed, but it will be more parasympathetic activities there. Heart rate will lessen, blood pressure will lessen. So check the blood pressure, respiratory rate, pulse rate, those things as well when you are examining these people, and document those things. And you can refer to the psychiatrist as well if it's under influence of liquor, and you see he needs to stop this, and any drug addiction, you can refer to the psychiatrist as well. Okay. Right. So confidentiality and privacy. So these child abuse cases, sexual abuse cases, about this post-mortem, don't divulge any information to anyone. You have to take the consent. Without consent, you can't talk about these things, because you can get into trouble. And if it's like HIV positive person, you can't tell this to anyone. It's a very confidential matter. Okay. So you have to maintain the confidentiality and privacy. Otherwise, there will be breach of the confidentiality, and professional misconduct will occur. Right. So what is this dying declaration. So I say showing you various aspects that you can get into. So recently there was a patient with burn surface area more than 90%, and she was able to talk. So homicidal situation, so she can give that information about what happened. So that is very relevant for the case. So how to take this dying declaration? So it can be taken by the police or the doctor, and the patient has to be conscious and rational and knows that she is going to or he is going to die, knows imminent death. And yeah, you can get this as a oral recording or video recording, or you can get it written and you can sign it, and or you can get the thumb imprint, and they say mainly the left thumb imprint can be taken here. So next time if you get this case, get the dying declaration. So very relevant in homicidal cases. So that recent case was homicidal one, so very good to get that. And what is this dying deposition? So if you have some more time, you can inform the police to inform the magistrate. Then the magistrate will come, and the police will come, and the lawyers will come, defense lawyer and prosecuting lawyer, and the relatives will be also there. So big scenario. So dying deposition more admissible in the court case. If you have enough more time, you can go for that one. Otherwise, at least get the dying declaration. Right. So what is this pathological postmortem? So what we do is the medico-legal postmortem. Who does the pathological postmortem? So pathological postmortem, the cause of death is known, and the consent is needed from the relatives. The medico-legal autopsy, consent is not needed. When you get the order, you can do the postmortem. But here, the consent is needed from the relatives, and approval from the head of the institution should be there. And who conducts this is the consultant histopathologist. So newly, I think Dr. Kaushika is there. So what is this penal code? So previously I told about the code of criminal procedure. So there it explains all the procedures that will be done. So what is this penal code? You have to know about these things. So all these are there if you Google it. Yeah? In the penal code, you have the offences and all the punishments. So big list is there, about 400. You can just read it up. So male or female, what is the age of criminal responsibility? So if it's less than, that child is less than 8 years, even if something happens, that the child won't be charged for anything. So minimum age is 8. But if it's between 8 and 12, and the child can understand, be taken as a accused. So there are the psychologists and psychiatrists and the forensic expert will have like a multidisciplinary approach and decide whether that criminal responsibility will be applied. And so this assault, sexual assault, rape, murder, everything is there in the penal code, the offences and the punishment and the charges. So you can just Google it up and see these things. Right. So this other thing is this photography and videography. So don't even this lecture, don't photograph or videograph without consent. So I gave consent to doctor. So you always take the consent. So if you don't take consent, it can be taken as a harassment. Or if it's a female, it can be taken as a sexual harassment. Okay, so don't just photograph or videograph anything. So it has a you can fall into trouble with these things. Right. So another thing I want to show is this private practice related issues can be there. Sometimes you get these injured people coming for treatment. Okay, sometimes road traffic accidents, assault incidents. And sometimes they lie also. They say they fell somewhere or something. And these situations, these medico-legal cases, must be definitely referred to the government hospital. So then the police should be informed, the MLE form should be put, and the BHT is needed for court cases, compensation cases. Sometimes they go to the private sector and they have some road traffic accident, or they have some assault or something, and they get the treatment, and slowly they go home. So these cases can be missed, and sometimes later to ask to report about the compensation purposes. So big issue there. So don't treat these people. They should be referred for the government hospital, and that MLE form should be filled, and these medico-legal cases can come. So how to identify these suspicious cases? So normal falls leading to injuries due to blunt force trauma, these abrasion, contusions, lacerations are normally they are in the bony prominent areas. These assault cases, normally it's in the recession areas. So identify these, and this assault in the bone recession areas, and road traffic incidents, you commonly get these grazed abrasions. And sharp force trauma, they bleed profusely with clean edges. So try to identify these things, and don't like if you have somebody, just advise not to see these patients. They should be referred to the government hospital. Right. So another miscellaneous thing I just want to address, this sometimes when you are in the quarters, you can get attacked by the wildlife, like the monkeys and those things, and you can't attack them or you can't kill them. Okay, where it is also a punishable offense. So it's there, the Animal Act is there. So you can inform the wildlife law enforcement officers, the regional office is there in Udawale. So this wildlife forensic, I just want to just address it now. People can fall into these kind of situations. So what to do? You can't harm the animals, you know, you can't kill the animals. You can take some other action. I just want to just address this one also, because you can get that in your experience, no? Right. So then now we'll show you the video also. So any questions? Can refer. Can. No need. We can, because we will and refer to the psychiatrist, and if needed venereology, and if needed any other referrer, you can straight away refer to us. No need to examine. If suspicious, definitely send to us. And if needed, sometimes in child abuse cases, we might need to exclude any fractures. Then we need to do the full body X-ray. So there can be that epiphyseal fractures, metaphyseal fractures, diaphyseal fractures, those things. So then that X-rays, full body X-rays should be done. Otherwise, examination we can do, no problem. That good question. So that post-op deaths also, definitely mainly they will go for the post-mortem. That is not included that in that code of criminal procedure code, but it's a new thing that is added. And all post-op deaths will be post-anesthetic deaths, post-operative deaths. Definitely they will be going for the post-mortem. Actually, that inquirer should also be advised. Sometimes they also don't know these things, and they should be advised what should be going for the post-mortem. Yeah. So this definitive cause of death and probable cause of death. So probable cause of death is all right, no problem. So definitely, if you are sure, you can give the definitive cause of death. But giving the probable cause of death is no issue. You can they can proceed with everything as normal. But if you are definitely sure, you can go with the definitive cause of death. The thing is now, when you give the probable cause of death, you can change it later with more investigations, histopathology or toxicology. If you get some more information later on, you can change the cause of death. You have seen that in Colombo, that one that case that initially it was given as some homicide, and it became suicide. Some issue was there, so that he had initially given the probable cause of death. Then he can change, but that probable cause of death you can change it later, no problem. But definitive cause of death you can't change. So but the process will be normal, same. Better to give the probable cause of death. But we are 100% sure you can give. Otherwise, no issue. The normal medical officers. Then definitely it will go for the autopsy. But sometimes I have come across those kind of instances. They have challenged, and cause of death given as acute myocardial infarction, and sometimes after we do the autopsy, it's sepsis and some wound is there, diabetic and those things, or some diabetic ketoacidosis or something. So those kind of instances are there, but if in Colombo region, I see that they go into more trouble to get, like accuse the doctor, but when you go to the periphery, it doesn't happen much, but can fall into trouble. But we somehow we try to not go in that way. We try to somehow talk with them and not to go with those procedures. So people can fall into errors. No error can be there. But after the autopsy, they are satisfied. And so mostly I have not come across anyone who has gone in such a way. But the risk is there. But we somehow we talk with them and we don't let that happen. Medical negligence is that they say that it's mainly by that wording is given by the courts, that medical negligence cases. So what the main thing is not do anything that will go in the medical negligence way. That for to prove medical negligence, there should be that doctor-patient relationship, and there should be that bond between them, and there should be a harm to that patient. So all these criteria should be proved, and that verdict is ultimately given by the courts. So it doesn't come to us, it will go for the court case, and what we should do is not do anything that will go into those criteria and lead to medical negligence, because they have to prove that that doctor-patient relationship is there, and there will be harm with that bond, and those things they have to prove. So main thing is do your duties and get the consent procedures properly, then you won't fall into trouble. You can play that video of the death registration process, so some people don't know this.